Hello, my friends. I'm Dr. Sarah, urologist and men's health expert. Today, we're having one of those questions people think about but rarely say out loud. It's time to bring it into the light because honest talk about intimacy helps us learn, connect, and realize we're not alone. This space is about sexual health, confidence, and intimacy at every age. Because here's the truth: intimacy doesn't retire, passion doesn't expire, and love, when cared for, only deepens with time. So let's dive into today's big question. Is it safe to swallow vaginal fluids during oral intimacy? What about taste and smell? Are they normal? These are questions whispered in private or searched late at night. But here we'll talk about them openly, without shame, and grounded in science. Stick with me. By the end, you'll feel reassured and confident in how to approach intimacy. Oral intimacy is far less taboo than it once was. Many couples, even in their 60s and 70s, describe it as opening a new chapter in their relationship. But like any intimate practice, it deserves knowledge and care. What are vaginal fluids? They're not just moisture. Vaginal lubrication is the body's natural way of reducing friction, protecting tissue, and signaling readiness for intimacy. Even beyond fertility years, these fluids keep intimacy comfortable and pleasurable. They mainly come from three sources: the Bartholin's glands at the entrance, releasing fluid to ease friction; Skene's glands near the urethra, adding fluid during arousal; the cervix, which produces mucus that helps maintain balance and moisture. Together, these create a fluid that may look clear or slightly milky, nature's way of preparing for connection. Taste and smell. Just like sweat or saliva, variation is natural. Hydration, diet, hormones, stress, and even medication all play a role. Pineapple and citrus often freshen taste, while garlic, onions, alcohol, or coffee can make it stronger. Around ovulation, fluids tend to be neutral. Around menstruation, slightly metallic. After menopause, they may be less abundant and more acidic. And here's the key: none of this is abnormal. Every woman's natural scent and taste is unique, but sudden unpleasant changes, especially with itching or discomfort, may signal an imbalance like bacterial vaginosis or yeast infection. Both are common and treatable. Now the big question: is it safe to swallow? For healthy partners, yes, it's generally safe. Vaginal fluids are mostly water, amino acids, enzymes, and lactic acid, designed to keep the vagina healthy. In fact, they pose less risk than things we do daily, like kissing or sharing a drink. The real risk comes from STIs. Fluids like semen or blood can carry infections such as chlamydia, gonorrhea, herpes, syphilis, trichomonas, and HIV. Risk increases if one partner is infected or if the receiving partner has mouth sores or bleeding gums. So what's the wise approach? Know your status and have open conversations. Get tested together. Twice a year is a good standard. Use barriers like dental dams early in relationships if needed. Safety doesn't kill romance, it builds trust. When couples know they're healthy, intimacy becomes freer and more joyful. Emotional meaning. For many women, acceptance is more powerful than technique. When a partner embraces her fully, including her fluids, it says, "I accept you completely." That dissolves shame, builds trust, and deepens arousal. So is swallowing safe? Yes, for healthy couples. Are variations in taste and smell normal? Absolutely. The real secret to great intimacy is communication, honesty, and compassion. And before we wrap up, one note for men: skip the sketchy pills online. I only recommend two evidence-based supplements. For a light boost, organic watermelon extract helps blood flow and firmer erections. For more complete support, testosterone, stamina, libido, and prostate health, there's an advanced formula combining ingredients like tonkat ali, fenugreek, and nettle root. Links are in the pinned comment and description. Take care of your health, your confidence, and your intimacy, because passion doesn't retire.